Thank you, Mr. Chairman. Thanks to the witnesses for coming to testify before us today. This is an important opportunity for us to focus on issues pertaining to transparency in the cost of health care. Dr. Sachdev, as a fellow Hoosier, you know that Indiana has recently passed important legislation, as you noted in your opening statement, such as HEA 1004, and also requiring at least 85% of each drug rebate, which is broadly defined to include fees and other remuneration, to go to certain patients at the point of sale at the pharmacy counter, or ERISA-exempt employers get 100% of the rebates. You mentioned in your testimony several policy ideas addressing PBMs. Could you talk through your ideas that you think this committee should consider legislating and how Indiana is leading in this regard?
Thank you so much. Yes, we passed the PBM legislation is in SEA 8, so that's where that particular language comes from. So we need to codify the Transparency and Coverage Act and include the pharmacy information in that. Prohibiting gag clauses with all parties, including insurers, but now that they've merged, it has to be all parties, including those group purchasing organizations, those GPOs that they contract with. A lot of the legislation around the country at the state level is focused on PBMs and the rebates that they have negotiated with the drug manufacturers, but now there's this other entity over here called the GPO, and they're negotiating. So if you're just targeting the PBM, you miss the GPO. So that's an opportunity. Spread pricing is a huge problem. We've heard about pharmacies, independent pharmacies, getting paid less. There are issues. You can pay a pharmacy a certain amount, but then the PBM can claw it back, which is like, I paid you $100, but now you got to pay me 50 back. So we need some insight into clawbacks. Also, and this is a particularly shady process, where they'll pay the pharmacy a price for a certain drug claim, but they'll charge the employer much more for it. That's why we need total transparency through the whole supply chain, so the employer can do that audit all the way through. Merger and acquisition oversight, and because we have seen all of this vertical integration, we really need to think about how to prohibit self-dealing. You know, I'm the insurance company, I'm the PBM, I'm the pharmacy, but the employer and the patient pays for everything. So I'm just taking money out of one pocket and putting it in the other. They really shouldn't be allowed to self-deal.
So thank you. And like you, I continue to be frustrated. I hear from constituents a lot, concerns about the practices of pharmacy benefit managers, how consolidation of PBMs has taken away options for plan sponsors and patients. Do employers have flexibility when designing their prescription drug benefit programs?
They have limited flexibility. Sometimes the PBMs will say, here's your drug formulary. If you want to make any changes to it, you can, but we're going to charge you a huge fee to make any changes. So when they do the math, they're like, gosh, I just wanted to take a few drugs off or get biosimilars on because there are no biosimilars on the formulary, but now you're going to charge me $1 million to do that? That's ridiculous. So they shouldn't be able to charge fees because you're really handcuffing employers by doing that. If you're not going to, you're saying, hey, you can do this, but then these fees, and they have so many fees, really, for doing anything.
Thank you. I think that's why this transparency piece is so important. Yes. I've heard from constituents that they can no longer get long-term supplies. They can only get a month's supply of their prescription drugs, and then the cost is 3 times higher than if they had a 3-month supply. So we're currently investigating if it is a PBM issue or another issue that's causing their prescription prices to go up. But when we have increased cost of health care, like going to a different facility, buying a facility, going across the street, and then it costs more, consumers know that there's something not right about that, and it is incumbent upon us to try to contain these costs when possible. Nearly every healthcare-related constituent meeting, someone brings up PBMs. So I look forward to this committee considering serious legislation addressing PBMs and their role as the middleman. Thank you for being here today.
Thank you for your work.